Hi, my name is Cassidy Freeman and I will be doing a complete bed bath, but only half of the body. So first I would wash my hands, get my supplies ready, go into the room and tell the patient my name and ask them what their name is and verify that that is the correct patient that I'm supposed to be doing this on. And then I would take the blanket off. And then I would cover up the patient so then they are warm and covered. And then I would take off the gown so then they'd get the dirty stuff off. This is a struggle right now. I don't know what's going on. Okay, there we go. There. Okay. And then I would fill up the water and make sure that it's a good temperature for me, and then I'd go over to the patient and have them feel it to make sure that it's okay for them. And then I would grab a washcloth and make a mitt. I'm struggling right now. Okay. And then I wouldn't add any soap to my washcloth. I'd get it wet and clean the eye. And I'd do a different part of the washcloth every time I wipe. And then just wipe around the face. Make sure that the patient's comfortable and I'm not missing any spots. And then I would put that one aside, and then I would dry the patient's face off, try to use different surfaces all the time. And I would grab another washcloth and now I can use soap. I'll do the arms first. And I would put a towel underneath the arm so then the bed doesn't get wet. And I would also do that for the head too when I washed the face. So first, get it wet. Then I'd work my way up the arm. So I would start down here, use different surfaces. And then once I get up here, then I would go in the armpit, make sure it's all clean. Set that one aside. And then I would dry what I just washed. And I would grab another washcloth and get it wet with soap. And I would wash the chest area, but try to give the patient privacy while doing so, so keep them covered as much as possible. And just wipe, switch it up a little bit. And if there's a wound or something, then I would check with the nurse first to make sure that if there's anything else that I really need to be doing. And then once that's clean, then I dry them off again. Okay. And then I would put on a new gown so the patient is comfortable, but we don't have one right now, so we'll just pretend that I did that. And then I'll grab a new washcloth and make sure that the temperature is still pretty good. If it's cold, then I would get new water. And I'd get another washcloth, and then I'd wash the patient's leg and work from down here first and then work my way up. And I'd put the towel underneath the leg too, so then it wouldn't get wet. Okay. And then I would dry the patient's leg off. then, oh my gosh, I'm running out. Okay, then I would get the towel or the washcloth wet again, and then I would do peri-care on the patient, so, and wipe from front to back, and use, okay, let's do it. And I would have gloves on too while I was doing all of this, but just use a different section of the washcloth every time that I washed, and then make sure, and then I would do like the inner thigh, make sure it's all clean, and then I'd grab a new washcloth, first cover up the patient, and have my assistant help me roll the patient. Yeah, we'll just pretend that it's okay. Okay, and then I grab a new washcloth, get it wet with some soap, and then wash the back. And then I would dry. Make sure that's all, there's no water left. And get another one and get it wet with some soap. And then I like wash the butt. Make sure that I get it all clean and try not to push anything up towards the front. If there's any like fecal matter or anything, then I would get that cleaned up and change the bedding and all of that. And then I would dry off and have the patient lay back on the back. And then I would move down here and clean the feet. Get a little bit of soap, but not a whole lot, because you don't want to get too much of their in between their toes. Different section of the washcloth. Make sure you get those toes clean. And I would dry the foot off. And then I would get new water. I would get new water after I cleaned her area and her butt. I would get new water then too. And then after I cleaned the feet, I would get new water and have them do hand hygiene. So I let her soak her fingers for however long she wants, and then I just make sure that there's no nothing in between her fingernails or on her fingers, and I would dry them off for her. And then I would ask the patient if she would like any lotion or anything else, and the gown would be on her, and then I put the blanket back up on top of her too. I'd make sure that she had her call light and if she needed anything else. And then, yeah.